It's another Wednesday with your fertility specialist. I'm excited to be your host, Ruth Ogogo. On behalf of Alps Hospitals, I'd love to say a very big thank you to our dear viewers. Thank you for liking our posts. Thank you for sharing. Thank you for always staying glued to your screen. Yes, it's Wednesday, and today we'll be talking about infection and infertility. Yeah, infection. Today, to tell us a lot about infection, we have a very, very special person with us today, an amazing doctor. She's Dr. Jane Ojani. Dr. Jane, forgive me in case I don't pronounce it well.
It's fine. It was well
oh,
pronounced.
thank God. Yeah, so just like she looks, she's an amazing personality. She's a consultant gynecologist. Yes. And the head of clinicals at Alps Hospitals. Wow.
Thank you, Margaret.
It's good to have you with us, Dr. Jane.
Thank you very much for having
Yeah,
me
Dr.
once
Jane
more.
with the C's. Yeah, so viewers, keep your thoughts, your comments, questions in the comment section. We'll definitely attend to them. Right now, as about starting, share this link with someone, call up someone, and just make sure you have someone joining you to watch this right now so they're able to get so much information about infection and infertility because we've noticed or we've observed over time in our generation and over time past and even now that infection seems to be a very very common thing that affects people and the people sink into infertility unknown to them that infection might have just been the cause of the infertility they are battling with. And then, yes, I was going to ask Dr. Jane what this infection is because I hear a lot of people say I have toilet infection. So it gets me wondering whether it's only toilet infection or is there something like toilet infection really? What's really this infection that we're talking about?
Well, to start with, I would say there's nothing like toilet infection.
Okay.
But
Okay.
generally, we are talking about infections that can affect fertility generally.
Mm,
And infections, I would say that their introduction of microorganisms.
okay.
Microorganisms can be bacteria, as we all call them, fungi, viruses, and all whatnot.
Mm.
And once they're introduced in any part of the body, they can penetrate that part of the body and cause harm.
Wow.
Yes. So these infections, generally, we are going to be talking about infections that can affect the reproductive tract.
Mm.
Yes, because it can be for both males, it can be for female. There are different ways that these infections can come. There are different types of them. We have sexually transmitted infection,
Mm.
tuberculosis, mumps, and all of that.
Wow. Oh,
So
yes. So I was going to get to the point of examples because, dear viewers, I hope you're learning so much. I want to still emphasize call up someone right now to join you because infection is a serious menace in our society. You can't afford to miss this and you can't afford not to call someone right now. Please make sure you call up someone and let them get this information so you're able to improve on your life and your lifestyle and thereby improving your fertility outcome in the future just in case you're not looking at fertility for now but then you it's good to stay fertile all the time even if it doesn't matter to you now. So for the time being as your age permits, so let's call up someone please so you're able to get so much information and you're also able to share this knowledge with people and people are well informed. Okay, yeah, so let's get to what are some of these common infections that actually affects people. And okay, let's deal with the common infections first before we talk about the symptoms.
okay, that can affect people and their fertility. By
Fertility, yeah,
that you
yeah.
mean?
Mm.
Okay, commonly we have what we call sexually transmitted infections, which are what we commonly know that you hear a lot of people say gonorrhea,
Mm.
chlamydia infections. Those are the major culprits. But we also have some other bacterial infections. Well, the names, they are there. They can affect the reproductive tract. You can
Okay.
also have viruses like mumps.
Oh
Yes,
wow.
mumps
Hmm.
can cause some significant infection around in the
Hmm.
testis, and the
Hmm.
testis is where sperm cells are produced,
Hmm.
affecting quality, quantity, and also
Wow.
functionality of those
Wow.
sperm cells.
Hmm.
Yes, you can also have blood infections like tuberculosis that can be
Hmm.
gotten from just droplets. Yes, there is
Yes.
significant cause of that can affect the lining of the womb, causing what we call
Wow.
scars and lead
Wow.
to infertility. So a whole lot of bacterial infections, but even HIV.
Hmm.
HIV can also
Wow.
affect fertility.
Wow.
Yes, the presence of, with HIV, there's reduced immune response.
Hmm.
So the ability to pick bacterial infections is very high, or your risk to pick those infections. Then
Infections.
when those infections come because of HIV again, so they have like a cross relationship. The
Hmm.
cause of the HIV and how it affects the reproductive tract or
Right.
organs
Yeah.
is also faster and is even
Okay.
more for
Wow.
some time.
So you
Yes.
see that there are just a lot of these infections, viewers, that could actually affect fertility. So as we continue, please, I hope you're noting this. I want to see your comments, I want to see your like buttons popping up. And I know that you're already having a good time with this chat right now. So keep your questions, your concerns, your opinions. Let's have them rolling into the comment section. I will definitely attend to them. Okay, so a lot of people might even have infection and they don't even know they have infection. Are there some symptoms that people would look out for that would be a pointer for them to know that it's possible or it's likely that you're having infection? And then let's even assume they don't have symptoms. How frequent would you advise them to check themselves just in case they just might be and is not yet showing symptom?
Okay, well, common symptoms for women, we will commonly have abnormal vaginal discharge,
Okay.
sometimes offensive. They will
Wow.
have lower abdominal pain,
Hmm.
commonly.
Hmm.
Some would have fever. Those are
Wow.
typical for what we call pelvic inflammatory disease.
Disease.
Yes.
Okay.
Then, but of course, there are other sexually transmitted infections. Not necessarily you could have a rash on your genital
Hmm.
area,
Hmm.
sores,
Oh
ulcers,
wow.
and all
Hmm.
of that.
Hmm.
Those are things that would point to some of these sexually transmitted infections that
Infections.
would necessitate you checking yourself.
Okay.
For the men, yes, we have what we call so we have this tube that takes the sperms that we formed from testicles,
Okay.
called the epididymis.
Okay.
So it
Okay.
can get infected or inflamed.
Okay.
So, and sometimes they will come with significant pains and
Wow.
all of that
Okay.
around the testicles and
Okay.
all of that. So when you have any of these symptoms, but to note is that a lot of these symptoms, then just to add for women, chlamydia, one of these infections, most of them don't have symptoms. Some run very quiet indolent course, and just in long term, about 10, 15 years, they come down with the complications of this
Of these
infection.
infections.
But
Wow.
commonly, some of these infections, one of these pelvic inflammatory diseases, if most women would have symptoms shortly after menstruation. So a
Hmm.
woman just finishes her menstruation, notices abnormal vaginal discharge, lower
Hmm.
abdominal pain, she should come and be checked. Most likely, she
Hmm.
might be dealing with one of these infections that could
Okay.
affect, in
Her
the long term,
fertility.
fertility. Yeah.
Wow. Okay. So she just also let us know that some of the ways, even when you don't show symptoms, some of the ways that you could know is just after your period. So for a woman that is suspecting that, okay, or maybe you don't even know, just for you to check and let them tell you that you're fine. That's another way for you to. Okay, so now we've talked about the symptoms, and I know you've mentioned what these infections could be. um how what's the impact now, because we're actually talking about its impact on fertility? What's the impact of this infection? Because I know I heard you mention moms, and then I know I'm used to seeing moms in probably children. So how is something with childhood now suddenly in the, yeah, like, I mean, I know a child is not thinking about fertility at that point, or is he when person is an adult that it affects them? So let's know some of the impacts of these infections on fertility for the man and for the woman.
Okay, so infections generally that can affect the impact for both men and women.
Mm.
Commonly for women, you would have what we call scars in the lining of the womb.
Oh wow.
You can also have you can also have blocked. tubes.
Oh wow, are
It
you
can also
serious?
cause the whole pelvis. So now the
Hmm.
pelvis is a part of the body, lower body, that houses the reproductive organ. For some
Yes.
women, this infection can be significant for them to accumulate what we call pus in the
Hmm.
pelvis, and
Hmm.
that would lead to the organs sticking to themselves, what we call
Hmm.
frozen pelvis.
Wow.
And that would now encase the ovaries,
Oh
the
wow.
organs. So
Hmm.
restriction of mobility. Sometimes
Yes.
it blocks the tube. You now
Hmm.
have water in the tubes, and
Hmm.
all of this can actually affect fertility for the woman. Even tuberculosis, what it does, it causes scars in
Oh
the lining of the womb, thereby
wow.
preventing implantation
Plantation.
and all
Okay.
of that. For the men, then infection generally cannot cause what we like called immune response. So
Hmm.
these organisms can have the body can generate immune response that can also affect some of the quality or these productive organs to produce some
Hmm.
of these hormones and also help with fertility. For the men, we now talk about mumps. So
Hmm.
mumps is it's a viral infection. Yes, commonly we
Okay.
see moms just throughout the year. You hear of this swelling in young children, fever,
Yes.
and pain.
Yes.
But moms can also affect the testicles, and
Hmm.
it's called momsochitis. And
Wow.
we said earlier that mom and the testicles or testes is where sperm cells are
Are
produced
produced.
and even
Yes.
stored before they are transported through the tubular structure. We talked
Hmm.
about epididymitis.
Yes.
So if it affects it,
Hmm.
it can affect quality, talk of
Yeah.
quantity, and we know that quantity or volume of
Hmm.
sperm production, sperm is the one of the causes of
Hmm.
infertility in men. So this
Yes.
is one of the
Wow.
pathways for infections.
Wow, so viewers, this is really an eye opener. So for people, for parents, so you see that this is not just for people that have fertility issues. This is not. It's also for you to note when you have children. You should be very careful about how you treat some of the these illnesses that they come down with, and that's why it's good that you seek help on time and don't just do all the local or self medications that you know how to do. And then even
Yes.
when I was growing up, then I used to see when a child has mumps, they'll chew kernel and then they'll I think they'll now put
The
the
scrapings of the wall.
oh my god,
Scrapings of the wall on their
on
cheek.
the cheek. I don't know the mechanism behind that, but so you see, if something as mild as mumps that some people would see it as is that means is serious than we actually can see, or is serious or more severe than we even know. And that's why you shouldn't take all these things likely, even with your children, as when they come down with some of these illnesses. Some of them, a couple of times, it's like some of the infection that children even go through are even viral, and sometimes you never can even tell the
Yes,
one that
very
would
true.
actually have
Moms.
a long term effect later on in life. And that's why you
Yes.
shouldn't just allow them anyhow. You should make sure you take care of your children well, and as much as possible shield them from the clouds of
Infertility.
oh god. Well, yeah, so yeah, so that's it. Well, so I was also going to ask, what are some of the complications that could arise from infection? Because okay, this is we now just talking. Okay, let's even say, even if we're not talking fertility, what are some of the complications that could arise from untreated infection or infections that are poorly treated?
Basically, that is the complication we are now dealing with is infertility, as
Mm,
you have said, and
mm,
infertility is a big problem in Africa, and
yeah.
most infertility infections is one of the leading cause of infertility in Africa,
Mm,
and maybe low income countries generally, and that's one of the basic things. Then some persons will have blocked tubes to a point that they begin to have pregnancies in abnormal locations like
hmm.
ectopic and all of that. Those
Yes.
are also significant cause of worry, and those are also gynecological conditions that are life threatening. So some
Yes.
of those things, basically, we are dealing with infections if they are poorly treated or untreated, and the most times they are long term effects. They are not things
Hmm.
you see in the present, and that is why prompt diagnosis and treatment is very
Treatment
important, and not
is.
just treatment but also treatment of contacts within 60
You
days
know, now
of
you're mentioning
symptoms.
it. I've actually, it gets more because I've heard a lot of people that they'll say they are treating infection, and then they gulp all sorts of herbs,
Yeah.
and then they'll say, maybe they'll tell them the period came and the period was very painful, so they told them that it's infection. And then the next thing, they are drinking all salts. I mean, are there proper ways to actually treat this infection? Because I think people should be well enlightened
Yes.
and not do it the wrong way, and then things go sour along the line. So, what are some of the proper ways that these infections could actually be curbed or treated, so that people are also enlightened and then they do what is right and not think they are treating, whereas they actually doing more harm to themselves?
Well, having an understanding of the problem is the first
Hmm.
step to proper
Yeah.
treatment.
Hmm.
So, if we are discussing the impacts and complications, it means that for every abnormal discharge, for every pain a man has around the testicles, for every infection that is suspected to be pelvic sexually transmitted, the right thing is to seek prompt care in appropriate places where the treatment will be offered. A lot of times we get people presenting late because they are self-medicating, indiscriminate of antibiotics. Every infection is ampiclox. I want to tell you this afternoon that most of the times those organisms might not respond to what you are using. And
Hmm.
so it takes understanding of the science of these organisms to give appropriate antibiotics, appropriate medications for you to get proper treatment and prevent the sequelae or the consequences of infections.
Okay, so well, this is me just asking for the sake of the public. So you have some people that feel like they are not sexually active, or some of them will say that since some people might even be watching right now and they are like, okay, since I don't engage in sexual activities, this topic is not for me. So is it just people are like that? Let's say, is it just people that are active sexually that's actually at risk of this infection, or this infection could actually happen to anybody? Like,
Well, for people that are sexually active, they are high risk, and that is why high risk sexual behavior is a significant risk factor. And to
hmm,
treat and prevent, you must curtail your sexual behavior.
hmm,
But like we mentioned, other bacteria. We also mentioned that tuberculosis, which is a droplet infection, it means you get this infection
from
from the air.
inhaling, yes,
Then mumps is a viral infection that just you
yes,
contract from
mm-mm,
others, from person to person.
yeah,
So you see, you don't have to be sexually active.
active,
Then look, we talked about HIV being
hmm,
also one of them. Yes, not a very direct cause like we have with chlamydia and gonorrhea and the rest, but you can get that from sharing of sharps. So
hmm,
that is an important way of preventing
hmm,
using unsterilized instruments and
and
all of
all
that.
that,
So you
hmm.
don't have to be sexually active to get some of these infections
Infections.
that in the long term can affect your reproductive organs and affect
No, no.
fertility.
Wow, wow, wow. So there's just a lot about this. So, well, viewers, you see that yes, for someone that has actually just shut us out and say, okay, this topic I think is for people that are sexually active. So it's not just for people that are sexually active. It cuts across everyone. It's more like saying everyone is likely to be you're at risk of it. Depends on the level of exposure you are to possible ways that you could actually get them. However, Dr. Jane would also let us know what are some of the lifestyle modification that people could actually do to reduce their risk of coming down with infection, because some people are actually, I think, very careless, or there are some practices that people engage in that actually could increase their risk of coming down with this infection. So let them know, so that if there are some things they need to unlearn and learn new things, so that they are also able to reduce the risk of coming down with some of this infection. What are some of the lifestyle modification or some of the unhealthy habits that you think people should desist from and embrace good habits?
Well, some of the lifestyle or habits that can help reduce this risk. We're talking about well, first thing, abstinence. Well, it sounds somehow, but it sounds like it's something that we cannot deal without. But abstinence is very important. It means when
Hmm.
you abstain, less sexual exposure, because you might you might be having sexual contact with one person, but that person has sexual exposure with multiple people.
People.
So it
Hmm.
means that you are also exposed, even when
Yeah.
you are assuming you are not exposed.
Exposed. Hmm.
Yes. Then also use of condoms. Yes, because with the increasing acceptability of other method of contraception like the loop, the implants and all,
Yeah, they are
the
they are
fear
they
of
are
pregnancy
shifting away from it.
significantly dropped,
Exactly.
but the
Yes.
risk of infection from unprotected
It's
intercourse from people
heightened.
that have high risk and all of
Hmm.
that is still there significantly.
Yes.
Even our personal hygiene, you know, excessive use of douching things because those things keep organisms and keep the place wet for a long time. So it means
Hmm.
organisms can increase or multiply
Hmm.
faster than you think. Yes, you know, frequent just cleaning of your genitals, not necessarily washing with your fingers in the vagina.
Hmm.
Then I think all those, then even social habits like excessive alcohol intake, cigarette
Hmm.
smoking, because
Hmm.
those things actually put you at risk of all
Hmm.
those harmful behaviors that eventually
Would
increase
lead
your
to
risk
which
of
of
acquiring
them?
disorder. So once we're able to control some of these things, to go a long way.
Yeah, are ladies that are actually very fond of using soap, and then I don't know, they want to make that place as sterile as possible. Oh, goodness. So they want to make that place. I say, I do well. Well, I don't know exactly, but you know, some people are extremely neat. That the kind of the way I don't want to. It's not wash. I would say. I think it's scrub. They are scrubbing it like. So you see, like Dr. Jane has actually let us know. Well, as funny as it sounds, there are actually people that really do these things, you know, over conscious of things, and then they over clean that place, then they reduce what you could call the flora or so that is there that actually help reduce their infection contraction and all. So there's just a lot of unhealthy. Dr. Jane also mentioned dodging. A lot of people engage in this. Then even I've noticed some people it's like, you know, in this part of the world, I don't know if it's just in Nigeria or Africa, you see some people that still use zip pieces, or what they call cloths for their men, as in when they're on their period. And then hygiene, menstrual hygiene is really very poor. And I know, even if I'm not in UPU's field, I know that blood and all these your infectious agents, they really have should I say they have a bond. Well, yes, all these are some of the things that could actually encourage infection, I think. Well,
Just to add is that you just let the woman you're talking about, the one that are very clean, that wash excessively, you just let you know that the vagina is self-cleansing. So whether you wash or not, it's going to clean itself. This the discharge that comes out is away.
hmm,
So you just wash the hair-bearing parts just
hmm,
with water. You don't have to. Well, if
just
you're going to use a mild toilet soap, you don't have to do the excessive washing and into the vagina. The vagina is self-cleansing.
wow. So that's another note. Don't have to do all the thorough washing. It's self cleansing. Yes, I've noted that. I'll write it in my diary. Oh yes, Dr. Jane, so what will be your counsel? Yes, we're talking about infection and fertility. What's the general counsel to the public with regards to infection, with regards to their fertility life and all? Like, just in I'm more like saying you should just summarize everything you've just said for someone that has not written all the notes. They should have one sentence that they can hold on to from this. Yeah.
Well, yes, so I would say infection is a significant cause of infertility in low
Mm,
income countries and Africa and
mm,
Nigeria, where we are. And
yeah.
it's very common, and common symptoms. Commonly, what we have is sexually transmitted infections, commonly gonorrhea and chlamydia. And they will cause what we call pelvic inflammatory disease, and those are significant cause of infertility. It can block tubes, can
Mm,
affect the lining of the womb, affecting implantation, encase your ovaries, freeze the whole pelvis, and all of that. Um, well, for the men, the same thing can affect your testicles and affect sperm quality, sperm transport, sperm function. It means that now that we have this knowledge, all hope is not lost. For someone that is battling one infertility or the other, your best bet is to be evaluated. The cause of your infertility will be communicated with you. And for those that have tubal factors infertility, which is commonly from infections and all, there's option of treatment. Tubal factor infertility, you can have IVF, and you can have other forms of treatment
mm.
depending on when you are seen, evaluated, and your treatment will be communicated appropriately depending on your symptoms and your
Okay.
situation.
So you don't just assume. Make sure you always get help from a good place. Because sometimes some people will just assume that infection has been treated maybe after taking any medication. Some of them just go to a pharmacist and then I don't know whether to call those people pharmacists now. Chemists. Maybe I should call
Drug
that's
shop.
what they used to call drugs. Some of them just go there because some of these people that have those shops are not actually qualified. And then, so when they go there, they just prescribe and then they take and they assume that they've treated whatever it is. Because sometimes, I think, in a way, when they take some of this antibiotic, it has a way of suppressing what they're probably feeling and then they feel like it's treated. And whereas ideal treatment has not been done. So when you know you're experiencing symptoms, aside your routine checkup that you do, please make sure you seek help from the right place. Yes. And yes, I mentioned earlier on about menstrual hygiene. Yes, I know that in this part of the world, it's not everybody that might be able to afford sanitary pads. But even if you have to use some other means apart from sanitary pad, just make sure you're hygienic about it.
And
You're
they're properly
hygienic, yes,
washed and
properly.
ironed and
Yeah.
sun dried.
Mm.
Yeah.
Yeah, that's sun dry. That guy, because a lot of people do bathroom drying.
Yes, in this part of the world,
Oh
all those
yes.
things are for the secret eyes.
Mm, mm. So yes, that's another point. Make sure you they are well sun dried and then well heated with maybe the way she said
Or
you
ironed or
iron
something.
exactly,
Yes.
so that you are also able to prevent some of these issues that could arise from your poor hygiene. And for someone that might have been struggling with infertility right now, maybe you've seen your fertility specialist and based on your history, they've seen that okay, infection might just be a strong reason for why you're going through what you're going through. um we sympathize with you and we hope that somehow you are able to find some, even if not a perfect cure, but some remedy just to help meet with your fertility dreams, and you're able to make the best out of whatever is being preferred to you. And we hope that you are happy at last. It's been so good having this talk with you, Dr. Jane.
Thank you for having me.
I know our viewers had a very good time with you. Thank you, dear viewers, for staying tuned to our live chats. Yes, for someone that has questions and probably you're just so shy about dropping it in the comment section, you could actually send a message to the number being displayed on the screen. You could send it via DM on WhatsApp. You could chat us up, or even on Facebook or any of our handles, TikTok. You could just send us a DM and we will definitely attend to you appropriately. Once again, we cannot thank you guys enough for actually joining. The list is ended of people that actually joined the show today. So I really cannot start listing, but just know we see you all and we appreciate you all for joining. Thank you so much, dear viewers, for joining and have a lovely evening. Bye.